malaria is one of sub-Saharan Africa's most common poverty-related diseases and a leading cause of morbidity and mortality among its young children who have not yet developed immunity to malaria and pregnant women whose immunity has been decreased. According to the World Health Organization's 2020 World Malaria Report, 409,000 people died as a result of malaria in 2019, and 67% of these were children under the age of 5. In 2012, the World Health Organization recommended a life-saving intervention to reduce malaria morbidity and mortality: seasonal malaria chemoprevention, or SMC for short.
Seasonal malaria chemoprevention is a preventive intervention that World Health Organization introduced, and it was introduced as a way of reducing the malaria disease in children under 5 in areas where malaria is highly seasonal.
Currently, SMC is implemented in about 13 countries during the rainy season in what we call the Sahel region of Africa. And according to the WHO, if we're able to implement this effectively, we will be able to protect about 25 million children and then prevent 20,000 deaths in a year from malaria.
The positive impacts of SMC on implementing countries are numerous. It provided some income for community health workers, helped reduce the burden on health systems, promoted good health practices, and among others, helped the Food and Drugs Administrations improve on pharmacovigilance. There is, however, more work to be done.
For the moment, SMC has a lot of success, but could be even more successful if it was done at the level of the scale that it should be.
The sustainable implementation of SMC programs is, however, at risk due to limited resources. Increased and sustainable funding is critical to ensure that children in the Sahel remain protected from malaria using seasonal malaria chemoprevention.